You're probably wondering, are the pharmaceuticals in my collection still dangerous? The answer is, well, it depends. According to an expert toxicologist and pharmacologist, modern medicines are designed to be stable for many years. They would be impractical otherwise, but all chemicals have different properties. Stability is affected by the chemical's purity, the conditions under which it has been stored, and the solvent, or what the chemical has been dissolved in. Pure compounds that are kept dry tend to last the longest. Some chemicals require special storage conditions for stability, such as refrigeration or freezing. What about historical medicines? Most drugs degrade over time, and this often makes them less dangerous. However, sometimes the products of degradation can be toxic. A degraded drug is not necessarily a safer drug. Quality and purity of drugs will vary. Some drugs may be contaminated with toxic chemicals. In addition, many historical medicines were not labeled with ingredient lists and quantities, or the ingredient lists were inaccurate. Medicine makers were not required to list their ingredients in Canada until the Proprietary or Patent Medicine Act of 1908. This bottle is a great example. It is not clear about what ingredients are within. What does this mean for handling pharmaceuticals in the collection? Containers in excellent condition with tight, secure closures can be handled just like any other museum object. When the container has a leaky closure or is not secure in some other way, always handle with caution. Condition is not necessarily static. It can change over time through slow degradation, even in controlled conditions, or quickly if dropped or otherwise damaged. Always default to treating a historical pharmaceutical you aren't familiar with as a potential hazard. If you have any doubts about your ability to safely handle a historical pharmaceutical item, follow your institution's hazardous materials handling protocols. Speak to a pharmacist, another museum professional, and/or a conservator, and/or refer to other reference materials in this package. Tips for handling hazardous or potentially hazardous materials. Personal protective equipment, or PPE. Here is some personal protective equipment that you should have available to you in your institution. Disposable nitrile gloves. Remember, rings with stones or other kinds of setting and bracelets or watches may tear your gloves and should be removed. A disposable particle mask, an apron or lab coat, and some form of protective eyewear. Safety glasses, or if you wear prescription glasses, you can use side shields or a face shield. And remember to always wear closed-toe shoes. Protecting your workspace. Here's a great way to set up your workspace. Start with a layer of white padding, for example, ethafoam. It protects the item you're working on or handling from a hard surface if you accidentally drop it. It supports the item, and the white background makes leaks and debris clearly visible. Sections of clear plastic sheeting should be placed over the ethafoam. This protects the ethafoam and the workplace from leaks and debris, and it's easy to discard if soiled. Safety protocols. Ensure you are familiar with all safety features of your space before beginning, for example, the location of the eye wash station. Work in a well-ventilated area. Work with a small number of items at once. Make sure to tell another person at your institution what you're doing before you begin work. Ask them to check in on you regularly. Work near a phone, one belonging to your institution, or you can keep a cell phone handy, and secure loose items on your person. Tie up your hair, don't wear baggy clothing, secure your jewelry, etc. Do an assessment before handling any items. Visually, look for cracks and leaks or other signs that something may be wrong. Also, pay attention to smells. An ambient smell may indicate a leak. Do not intentionally inhale. Here's a way to smell a substance that you are worried about. It's called the wafting method, and it's used in chemistry labs. Hold the bottle away from your body. Then use your hand to gently waft the vapors towards you. Do not inhale deeply, breathe shallowly, and do not use this method if you already suspect the contents may be hazardous. Don't get complacent. Old collections can spring new leaks. Once you're done working with your pharmaceuticals, for maximum safety, treat your soiled personal protective equipment as a hazard and dispose of it accordingly. Disposable gloves are not useful if the substance gets on your hand as you are removing them, so here is a way to take your gloves off safely. Pinch the glove near your palm, slowly draw it upwards, folding it over itself as you do so, creating a small pouch where the substance is. Ball that glove up in the palm of your other hand. Slide your fingers up your wrist under the glove. Do the same thing, turning the glove inside out. This creates a small pouch holding the substance and protecting your skin. An easy way to practice this glove removal technique is to cover your gloves with something messy but safe. Shaving cream is a really good option. Practice removing your gloves. If you can do so and get no shaving cream on your skin, you have mastered this technique. Store the items away according to your collection's management storage protocols. If you choose to leave these items out between working on them or while waiting for approval, ensure they are clearly identified as a work in progress. Use a do not touch sign and note the person to contact if there's a question about the objects. If you aren't able to return to work on them within a day or two, put them away for safety and to free up the workspace for you and for your colleagues. Safety once objects are in storage. Always indicate hazards on museum objects with a label. Make the label eye-catching. Colored paper and large letters are ideal for this purpose. Be specific in your labeling. Name the hazard, for example, red rot, a loose lid, leaking, or a sharp. Identify any unique handling instructions. If the object is heavy, needs to be lifted from the bottom, or is in separate pieces. Collections management never ends. Re-inspect items on a regular and rolling basis following your collections management inspection schedules. Even in environmentally controlled storage, items can degrade. Keep an extra watch on any object that is already in poorer condition or deteriorating. For example, a brittle cork or tablets that are powdering. Take a photo of the problem area to keep track of the progress of deterioration for the next inspection. And remember, you don't need to be scared of the pharmaceuticals in your collection, but you do need to be careful.